Hello, my name is Ying-Yi Hong. I'm very honored to give a keynote address today. And the title of my talk is How Does National Identification Matter for the Fight Against COVID-19? And I hope my talk can shed light on the theme of the webinar this year, researching intercultural perspectives, problems, and relationships beyond the pandemic. In particular, the talk that I'm going to give today is based on a recently published paper by my research team. And the talk consists of two studies. One was conducted in China and the other was conducted in the United States. To begin, around January 20 of 2020, WHO has announced that the coronavirus is transmissible from human to human. Subsequently, experts and government officials has recommended disease preventive behaviors for people to engage in. And the behaviors include washing hands, keeping social distance, staying at home or wearing masks, etc. And because COVID-19 is a collective crisis, curbing the disease requires people to jointly engage in these preventive practices. And indeed, there was simulation that showed if a good proportion of the population wear masks, the pandemic will be curbed and the spread will be much lower. However, there are much resistance to these disease preventive practices. And there could be a number of reasons. For example, disease preventive practices impose personal costs, including economic costs, physical discomfort, reduced freedom. And also some people underestimate the risk of being infected by the disease. And so they don't want to take the trouble of engaging in these preventive behaviors. Or some people are free riders. They just free ride on others' disease preventive efforts. And to curb against this, we look into people's social identity. Social identity is defined as individual self-concept derived from perceived membership in a social group. And many of you in the audience will know a lot about this research. People have found, or past research have found that social identity leads people to think, feel, and act on behalf of the group. And social identity also motivates people to concern the wellness of the group. And when you identify with the group, you prioritize collective interests over personal interests. So in general, past findings have shown that in-group identification predict in-group cooperative behaviors. Now, in our own research, we look into the beneficial role of national identification. We reason that when people hold a strong national identification, they will have a sense of common fate with fellow citizens. So they're more willing to protect fellow citizens by engaging in disease preventive behavior. And also, a strong national identification would unify people from subgroups in the nation to engage in behaviors that benefit the subordinate group, which is the national group. So here, let us to make a prediction, and this model is very simple. So a strong national identification would predict a positive engagement in disease preventive behavior. By engaging in this disease preventive behavior, which is a cooperative behavior, would reinforce the identification, the national identification as well. So the best way to study this, of course, is using a experimental design. However, because of limitation, our research group used a longitudinal design to test temporal covariation instead. And another factor that we look into is political landscape. And so, for example, China have a relatively homogeneous national discourse in the fight against COVID-19. And by contrast, the United States have a relatively heterogeneous national discourse on it. So in the first half of my video, I will talk about China, and then it will be continued in the part 2 of my video. Now, let's start with the study 1, which was conducted in China. Our argument is because China has a centralized and homogeneous government structure. So it's relatively easy for it to implement strict and mandatory regulations in a top-down manner. And also early on, President Xi have announced people's war against COVID-19. So it set up and sent out a very clear national message in fighting against COVID-19. So here, again, our predictions is a very simple national identification positively predict engagement in disease preventive behaviors. And then the more people engage in the disease preventive behavior, it will increase the national identification. The way to test this is we dispatch a survey using a mobile phone platform, Wenjuanbao, in China. And we conduct the survey in 2 time points. In time 1, which happened in February to March 2020. And at that time, the disease, the pandemic was quite serious. And it has about 900 some, about 1,000 new cases per day. And so participants fill out all the questionnaire in time 1. And then we catch them later in time 2, which is late April, when the cases per day have decreased quite a bit. It's only 11 per day nationwide. And altogether, 1,200 participants were recruited, and they are about the same in terms of gender, and they were with mean age 31 years old. So in the survey, participants fill out the same questions in 2 time points. We asked them about the national identification using 4 items. For example, at this moment, I feel good about being Chinese. And also we asked them about the disease preventive behavior, 10 behavior recommended by the Chinese CDC. So in the past week, how often do you wear a mask in public places? And also we measure a bunch of control variables, for example, positive, negative emotions towards COVID-19, the perception, the risk perception towards contracting the disease, confidence in the institutions, ability to tackle COVID-19, for example, scientists and government, and also the participants' own demographic variables, age, gender, education, and income. Now, this is a very simple plot, just a correlation, just to give you some idea about what the data look like. So on the vertical axis here is the time to disease preventive behavior. And then on the horizontal axis is time 1 national identification. So in general, participants score quite high on the national identification. So you can see they concentrate on this quadrant, and also high on disease preventive behavior. However, even if you drop the extreme cases, you still see a very clear positive relationship between the time 1 national identification and time 2 disease preventive behavior. So this is just a very simple scatter plot. So we conduct proper longitudinal analysis. So we look at national identification in time 1, whether it predicts disease preventive behavior in time 2, by controlling also time 1 outcome variable, time 1 disease preventive behavior. And indeed, the relationship was significant. The stability, although the stability of disease preventive behavior was pretty high. And mind you, actually, in time two, the average new cases was only 11 per day, but still people engage in disease preventive behavior. And also the engagement in time two, or the change in time two disease preventive behavior, was predicted by the national identification in time one. Now, the second part is the reciprocal effect. So did the disease preventive behavior in time one predict national identification in time two? Indeed, it did. We did a longitudinal analysis by controlling the time one national identification, and indeed it was significant. So the findings in conclusion is that the national identification indeed significantly predict engagement in disease preventive behavior in time two. And also the time one disease preventive behavior positively predict the increase in national identification. So this is the end of part one. And in part two, I will report the findings from the United States. Thank you. Welcome back to part two of my talk. So in part two, we will cover the study two, which was conducted in the United States. As I mentioned earlier, we think that the national discourse of the United States is more heterogeneous. For example, national goal to fight against COVID-19 was diluted by the political divide. Democrats emphasized the severity and need for actions more than Republicans. For example, this is a survey conducted by Pew Research Center in March 2020. So participants were asked to say whether the corona outbreak is a major threat to the US economy, the health of the US population as a whole, day-to-day life in your community, your personal financial situation, your personal health. And consistently, Democrats score much higher, seeing all these, seeing the outbreak as a major threat to all these elements, all these factors. They score much higher than the Republican, consistently. And also, at that time, President Trump downplayed the severity of COVID-19, at least in its early stage, saying that it's no difference from flu. So trust in the Trump administration should also reduce disease preventive behaviors. So based on this, and also based on the national identification, might promote trust in national leader for some Americans. And when you look at social identity approach of leadership, in-group identification usually promotes trust in leaders that represent the group. So at that time, it was President Trump. And also political conservatives and Republicans are more likely to consider Trump as representative of Americans because of their political membership. So this led us to predict, on the one hand, national identification should predict disease preventive behavior, which also should have a reciprocal effect on national identification, just in the same way as what we find in China. And this is according to social identity theory. However, more than that, we think that in the United States, trust in Trump would mediate the effect, and however, part of the link would be negative. So let me walk you through. So national identification, just as what we argue, would increase trust in the in-group leader, who was Donald Trump at that point. So higher national identification would result in higher trust in Donald Trump, especially for people who hold conservative political orientations, because they see Trump as more representative of Americans. And then because Trump said that the coronavirus is just like common flu. So when people trust in Trump, it will reduce their motivation to engage in disease preventive behavior. So this was the model that we propose. And in order to test our model, we conducted 5 waves of surveys in the United States. And the first wave was conducted when the number of contracted cases increased. So the vertical axis is number of new cases per day. And so we start our first wave of research in late March 2020. And we start with about 1,000 participants. And then we conduct the research every 2 weeks. So at the end of the 5th wave, we have about half of the group remained in the survey. And we have half male and we have 41% male and about 60% females in our sample. And the mean age is 39 years old. Now, in our surveys, each time participants were asked to fill out all these items. On national identification, again, we use the same scale. At this moment, I feel good about being American. Disease preventive behavior, we look at the 15 behavior recommended by the US CDC in the past week. Wearing a mask in public places, how frequent is it? Trust in Trump administration. At this moment, how much trust do you have in the Trump administration to act in the best interest of the public? Political orientation. So we look at to extend the support or identify themselves as liberal versus conservative. And then we convert it into higher scores, more conservative. So the same set of covariates was also measured as in study 1 in the China study. Now, to analyze the 5-wave data, we use latent growth model to look at whether the time 1 national identification predict the intercept and also growth factor across the wave. And so this is the result. We have already covariate in the covariates were included as control variables in the calculation. And so indeed, intercept of the growth factor was significant. So the T1 national identification indeed to predict the increase in trust in Trump. Actually, T1 predict T1 trust in Trump, and then T1 trust in Trump predict the growth factor of behavior, which is the increase, actually the decrease in the behavior, because this is a negative relationship there. And this link here from national identification and trust in Trump was moderate by the political orientation. And we find both a positive direct effect here, and then also a negative effect through Trump on growth, on the change in the disease preventive behavior. So I think might be a better way to look at, give you a sense of how the data like is through Scatterplot again. So the time 5 national the time 5 disease preventive behavior was is now on the y-axis, and on the horizontal axis is national identification. And we have 2 panels here. Here on your left-hand side is liberals, and here is the conservative. It's done by median split the participants. And so you can see we show a positive direct effect from the national identification on disease preventive behavior. And it's mainly driven by the liberals. The conservatives is slightly positive, but mostly flat. But we can see the stronger national identification in time 1. It has a stronger, or it predicts a stronger disease preventive behavior in time 5. So mainly for the liberals. Now, this shows the Scatterplot relationship between time 1 national identification and time 1 trust in Trump administration. So here again is liberals. So although, it's understandable that liberals don't trust Trump very much, so many participants show the lowest degree, not at all here at 1. But still, the data shows that it also supports the social identity approach to leadership. Indeed, the higher the national identification, the more trust in Trump, even among liberals. And for the Republican, it's very obvious, a strong relationship, positive relationship. The stronger the national identification, the more trust in Trump in time 1. And a trust in Trump in time 1 also predict disease preventive behavior in time 5, but the relationship is negative. So you can see it here in both for the liberals and conservative. Now, how about the reciprocal effect? Because in China, we see that the more engagement in disease preventive behavior in time 1 predict national identification in time 2, or the change in national identification. It predicts an increase in national identification in China. But now here is in the United States, you see, if anything, there is a drop in national identification, and especially for liberals. And so over time, there was no increase in national identification. And if anything, there is a drop in national identification. And also, these change were not related to participants' engagement in disease preventive behavior. A summary of the findings: U.S. national identification has mixed effect on the change of disease preventive behaviors. So it shows both the direct positive effect, just like what we find with the Chinese data. So it's consistent with China data. However, it also shows a negative indirect effect via trust in Trump administration. And the negative indirect effect was more pronounced among political conservatives. So the US national identification decreased slightly over time, and it was not related to engagement in disease preventive behavior. So in both studies, we test our very simple model. And however, there are a lot of limitations. For example, we are limited in sample size. Our sampling was not representative, and we rely exclusively on participant self-report. And also, we only have looked at a small facet of national identity, and we look at mainly the positive affect towards one's national identity. For example, I feel good I feel good being a Chinese. So that's more like a positive self-regard aspect of national identity. And also, we do not argue for a universally appropriate method in curbing disease outbreaks, nor are we making a value judgment that favors one country or its method over another. However, what we find quite consistently, both in the United States and in China, is that a national identification, stronger national identification, predict more engagement in disease preventive behavior. And after controlling for risk perception, emotion, and confidence in the institution. And this link actually was recently found or by another publication in September 2020. And in this study, they look at cross-sectional data comparing 67 countries. And this relationship holds for a wide range of countries, regardless of Eastern and Western culture or political system. So we can see quite strongly on this. Now, the question is, so do you recommend, a heightened or ways to increase people's national identification in order to enhance engagement in disease preventive behaviors? We think that we need to look at the big picture. So because national identity is complex and multifaceted, and the basis of national identity is related to political, social, cultural, historical, etc. So for example, in our own past research, we find that Chinese people's national identity entails more obligations, whereas Americans' national identity entails more rights. So these bases are different across two countries. And then also the nature of national identity could be different for different people. Some people conceptualize national identity as more fixed, whereas others view it as more malleable. So what we find is that fixed national identity will impose more guidance on people's behaviors than a malleable national identity. And also, we also find that people hold multiple identifications. So national identity is only one of the identities that people embrace. So from all these, we would not recommend just to increase or enhance people's national identity simply because you need to look also into the different nature of identity. So future research can examine all these aspects. And also extreme form of a national identification could be dangerous. For example, national narcissism have been found to lead to a lot of negative consequences. And in our own research, we find that national narcissism will lead to conspiracy beliefs about COVID-19. And then the conspiracy beliefs about COVID-19 actually undermine disease preventive behaviors. And also conspiracy beliefs will lead to higher prejudice and discrimination. So it won't be a one-size-fits-all way. And so increasing national identification might help to the extent that if national narcissism is going to be low, and no one country is safe until all countries are safe. But the pandemic posed a challenging context for intergroup relations, and we hope that our research can shed light on future studies to look into more of these perspectives, both how national identity is conceptualized and whether national identification will lead to national narcissistic beliefs, and also how national identification and national narcissism might be related to different type of beliefs, for example, conspiracy beliefs, and how they might affect the intergroup relations beyond the pandemic. And so if you're interested in what I talked about, you can refer to the paper that we published in Political Psychology. And if you have further questions or you want to collaborate, please contact us. And you can also visit our website at this link, and or you can scan our QR code. So thank you so much for your attention. Thank you.